Hi, everybody. I thought I would give an update today since it's been 1 year since I started taking tamoxifen. If you'd like to keep getting updates, please like and subscribe. And don't forget, if you have the means, to donate to mybreastcancer.org. It's a wonderful organization that gives breast cancer patients gift cards, like gas cards and grocery store cards when they're out of work for treatment. And also, they have volunteers that come into the home that provide dinners and help women do their laundry and clean their house and stuff like that when they're incapacitated through this process. And they're a really wonderful organization. The chapter in my Portsmouth area is run by someone who is a breast cancer survivor herself. So it's very near and dear to their heart, and anything you can give would be greatly appreciated. And I will continue my hiking series. I have a new GoPro camera coming, so I hope that the footage is even better than some that I've produced, which is a little shaky, but I'm trying. I only have 44 mountains left to go, so I'll do it. Um, so today, I thought I'd just give a brief overview of the overall side effects that I've had from tamoxifen, and just a little update as to my progress going forward, what I've been going through this fall. Tamoxifen, initially, I had hot flashes, dry skin. I've had an inability to lose weight. And I also had the hair on my legs. It wouldn't really grow very much. And I don't think I've had anything else that I can think of, well, in that regard. But part of the process is you have to go through a bone scan. So when you are premenopausal, like I am, tamoxifen can decrease the density of your bones. So you have to get a bone scan. And unfortunately, mine came back as having osteopenia. So I don't know if that's from the tamoxifen or just a result of age, but it's a pre-osteoporosis. So I have that in the base of my spine, which didn't make me very happy that I have that. But I have to take extra calcium, and I'm supposed to exercise daily to kind of combat that. I'm not sure that it's reversible necessarily, but I can prevent it from turning into osteoporosis if I do that. What I have not experienced is the mood swings, which is surprising. I guess tamoxifen is supposed to make you very moody and angry, or it can anyway. I've had a couple of minor outbursts. I had a little bit of an angry feeling maybe like 6 months after I was taking it, but I think that had a lot more to do with being done with the reconstruction process. It was shortly after that, through the spring last year, that I was just having a hard time, I think, and that's what I was going through. I don't know if it was tamoxifen related or not, but since then my moods have kind of leveled out, and I didn't experience it in the first few months I took it, so I don't think that's tamoxifen related, but I do know that that's a pretty strong side effect of it. What I am still going through today, I do have the occasional hot flash. They're not horrible. I get one or two after I take the pills, and I haven't even had night sweats or anything since I started taking these. So, but I do have to take the calcium now. I also, another side effect I had was the split nails, and that came with the dry skin. And I actually asked my dermatologist about that, and I've started taking another vitamin supplement for that, for the hair, skin, and nails. And my skin went from being really dry the first like 3 months I was on tamoxifen to the exact opposite, and I started getting acne and breaking out. That is still going on, so there's not much I can do about it. I I kind of feel like that's in a way a positive thing because it indicates younger skin, not older skin. So you got to look at the bright side of everything, I guess. But I do have acne from tamoxifen, so I have the osteopenia and the acne and the hot flashes. Um, and I also still don't have to shave my legs that much, like once a week. It's pretty cool. It comes in very soft, very fine. It is. It was kind of growing back a little faster over the summer, but this last like month or so, I've noticed that it's slowed down again. I don't know if it's seasonal or what, but um, it is still changing the texture and growth of the hair on my body, which is fine. I don't mind it at all. So that's pretty much all I'm still going through with tamoxifen right now. Um, the weight, I did gain weight during my surgeries last year. I went from like 120 pounds all the way up to like 136, 37, and I'm kind of still sitting there. I lost a little bit over the summer, thought I kind of cracked the code on it, and then this fall I've gained it all back again. So I don't know if it's tamoxifen related, but it is a struggle. It could be the tamoxifen. Um, it could also just be my schedule. I haven't had the chance to exercise like I used to. So I don't know. I do know it can be a side effect, but I also know that a stronger side effect is actually weight loss. And I have not experienced that. But supposedly that is more likely than weight gain. And I believe I probably am experiencing just normal weight gain that I'm not focused on losing. It's not a super high priority for me, so I don't think that it's tamoxifen related, but it could be. Other than that, I have to go to the dermatologist every year because during my mastectomy surgery, I had them remove a couple of questionable moles or spots on my skin, and it did test positive for basal cell carcinoma. So now I asked my dermatologist about my split nails when I went, but I also had a couple of biopsies, and again, I had one on my face come back positive. So there's a little red there. I'm doing a chemotherapy cream on that right now for like 6 weeks. That was positive. It's not basal cell. It was something else. I can't off the top of my head remember which carcinoma it is, but it was basically in the cell forming stage, and it's not full blown anything. So we've caught it before it became anything more serious, and I didn't need a surgical removal, which was good. But it's kind of crappy that I'm testing positive for one almost every year when I go in. So, and that is sun related. So I guess wear your sunscreen. It's my own fault. I'm outside a lot, and it really was never a priority. I was kind of a sun worshiper as a young lady, so you can't do anything about it at this point, but just wear your sunscreen going forward. Other than that, I have the same symptoms as before with the tamoxifen. And actually recently I had, and today even, I still have some lymphedema in my shoulder. It came back. I tried to start working out again, and I went on a huge hike, which I posted on here. I did 2 4,000-foot climbs in one day. I think the total was over 13 miles. But I really kind of overdid it, I think. And I got some lymphatic fluid built up again in this breast area and under this arm, this armpit, the shoulder. It's been very, like, all down to here, almost the elbow. It's been kind of swollen. Um, there is massage that can be done to try to get that out. I've been able to reduce it somewhat, but not 100%. And I also had one lymphatic cord come back again, which now I have the tools because of my massage therapy. I knew how to combat that and kind of stretch that out and massage that. So I did do that, and I was able to eliminate it almost within 48 hours of finding it. I was able to get it to calm down and released. But it didn't make me very happy that that I may be fighting them back and forth forever. I don't know. I thought I was done with that finally, and I got rid of them like what, 3.5, 4 months ago, and now I have one back again. So that kind of sucks. So I'm still dealing with that. But overall, I'm doing well. My day-to-day life has not been disrupted too much. Not like the first 8 months of going through it, where you're going to the doctors like 3 or 4 times a week. I now do 3-month follow-ups. I do have to get blood work and obviously the bone scans, and I still have to go to the dermatologist annually, which usually results in another visit because I have to have a treatment of some sort. But overall, life has gone back kind of to normal, and it's not horrible. But if you have any questions, don't feel free to put it down in the comments below. That's fine. I'll do my best to answer them. I'm not a medical professional, but I know my own experience, and I'll do what I can to help. So I'll see you on my next hiking video, hopefully with some new camera equipment. And it was nice to talk to everybody again.